Thank you very much for coming. Good afternoon. As he said, my name is Sean Saint. I'm the co-founder, along with Mike Netzinger, our CTO and CEO of Companion Medical. Been a medical device engineer for over 20 years now. Designed products for Medtronic, Dexcom, and Tandem. And 8 years ago, while running advanced technologies for Tandem, I was diagnosed with type 1 diabetes. Yep, diagnosed with type 1 while designing an insulin pump. As an engineer, I thought we designed the best option for people using insulin. But then my experience as a user was enlightening. And out of that experience grew Companion Medical and the InPen system, the first truly smart insulin delivery pen. My goals today are to describe for you the 4 categories of insulin delivery as I see them, explain why smart pens are the most broadly applicable of those groups, and why InPen is the optimal solution. So people like me who use insulin now have many options for insulin delivery. So it's helpful to think in terms of categories. All right? When making our choice for our optimum delivery device, most of us are extremely cost conscious, and we really have to balance 2 things. Our desire for the benefits that smart technology can provide, and our tolerance for inconvenience. Historically, we had the legacy or basic insulin pens and syringes. They're easy to use, they're inexpensive, but they offer no decision support or tracking tools of any kind. They're high in convenience, and they're low on smarts. Then smart pumps were introduced. In many ways, the antithesis of pens. They have great decision support tools for the user, but at a cost of both complexity as well as actual dollars. You have to wear them 24/7, refill them every 3 days, and interact with them multiple times a day. This category has managed to capture just 7% of the insulin delivery market in the United States and less than 2% globally. Now, borrowing some features from pumps and some from pens, we get the basic patch pumps. You still have to wear them, they still cost too much, and they provide no decision support or tracking features. Each one of these categories works great for some people, but given the low adoption from pumps to pens, I'm left wondering if the market's provided the optimum solution. Until now. Now we have smart pens. They're easy to use and they're inexpensive, and they provide the decision support and tracking features of the smart pump group. This category is being pioneered by the InPen system. InPen brings many of the benefits of smart pumps to the 93% of users in the United States that have previously not had access to them. And we do it with a seamless user experience and at a very low cost. This is InPen, the first integrated diabetes management system for multiple daily injectors, and it's easy to use. The pen itself looks, feels, and acts just like a traditional insulin pen. It is half-unit dosing, so it's best in class. It works with both Humalog as well as Novolog cartridges. Well, let's talk about smarts. The pen knows when you dosed, it knows how much you dosed. It knows the difference between a prime, squirting insulin onto the ground to clear the needle, and a therapy dose, an actual injection. It knows the temperature of your insulin, and it sends all that information over to your phone, either iOS or Android, by the way, over Bluetooth, with a battery that lasts an entire year, no recharging. Now, into the phone, we bring blood glucose information and CGM information, both through HealthKit, for a truly integrated diabetes management experience. On our home screen, we have last blood glucose and last dose, and importantly, an insulin on board display, just like a pump would have. We have a graphical depiction of recent doses. On our logbook, we have every dose, every prime, every dose recommendation, every carbohydrate, blood glucose, and even a CGM trace. And because we have all that information real time, we can provide dose reminders, temperature alerts for your insulin, and check BG after dose reminders. We take all that information, aggregate it, and bring it into our integrated diabetes management therapy report for healthcare providers, which we call Insights by InPen. You can share this report through email or fax right from the phone. So there's no downloading, no cables, no codes. Email, fax, or even print right from the phone. And lastly, we don't understand how you expect outcomes to improve without helping people understand how much insulin to take right now for each and every dose. And that's what a dose calculator does, just like a pump. So why are dose calculators important? Why is dosing hard? Well, you have to take each one of your recent doses and send it through a sixth-order polynomial. This will give you your current insulin on board. That's the amount of insulin in your body working to lower your blood sugar. You take that answer and you put it through this math here, the dose calculation math, to get your recommended dose. This is what a pump does. This is what InPen does. And this is what nobody can do in their heads. Now we know that dose calculators will lower your A1C by about 1%. But importantly, you need insulin on board data to be able to do that. Without that, you get stacking and an unsafe recommendation. And this is why dose calculators should always be associated with the insulin delivery modality. So either pump or smart pen. This is Insights by InPen, our report, or more accurately, it's about half of it. This is the blood glucose half. Modal day glucose on the left, strip charts on the right. And this is CGM, so it's a good, rich data set. You can get a pretty good idea what's going on with this person from this, but not necessarily why. Now let's take, for example, the middle strip chart toward the right. Glucose is rising. Why? Did the patient misestimate their carbs? Is their carbohydrate factor wrong? We don't know. But bring in InPen data, and the picture gets much more clear. In this case, carbs were eaten, blood glucose rose, but no dose was taken. It's a missed dose, it's a teachable moment, and it's exactly why healthcare providers have been screaming for this kind of data for years. It's just one of the many insights that our report provides. Now, just as important as what a smart pen is what it's not. So, that brings us to the point. And if you remember only one thing from my presentation today, remember this. Smart pens are not created equal. We know we have some competition coming, so let's put them in context. Legacy pens and syringes, obviously not smart. They do none of what we've talked about today. There are some tracking pens and caps coming. They have to be downloaded. They offer no decision support for the user. They're also not here yet. Coming down the road are some real-time pens and caps and clips. Right? Also not here yet. These have eased the burden of downloading a little bit by adding Bluetooth, but still offer no decision support for the user. And I think if we look up here, we can agree that the user experience and form factor of any of these devices is not what we would want. No, it's only when you provide true integrated diabetes management data for your healthcare provider and decision support tools for the user in a package that's easy to use and affordable that you can truly call yourself a smart pen. Now that we've talked about what a smart pen is, we can get back to the four categories here for a moment. I mentioned earlier that ease of use and cost are the driving factors here. So let's talk about both. In terms of cost, traditional legacy pens out of pocket are essentially free. They come with your insulin. Pumps, on the other hand, can be hundreds or even thousands of dollars, even when covered by insurance. InPen has seen a median copay of just $50 for the year. That's affordable. Now I want to talk about these four descriptors here for a moment. Easy, burden, informative, and integrated diabetes management. Easy. Is the product easy to set up? Is it easy to manage? Is there care and feeding associated with it? And even the prescription process. Burden. Do you have to wear it? Do you have to refill it every 3 days? Do you have to change the battery, charge the battery? Do you have to take it off to shower, to swim, or for some other social activity? Informative. Does it tell you what you need to know, when you need to know it? Did I dose? Should I dose? How much should I dose? What's my current insulin on board? And what did I do yesterday? And integrated diabetes management. Does it easily provide the information your healthcare provider needs to make insights for improvement? Now, not everybody's going to make the same choice up here, but I think we're making a compelling argument that InPen is a simple, inexpensive, powerful way to manage your diabetes that's going to appeal to the broad market. I'm not going to spend too much time on that market because most of us have a pretty good idea of what it is, But just as a quick reminder, maybe 52 million people around the world use insulin. About 1 million of those are on pumps. Focusing on the United States for a second, 30 million people with diabetes, 6 million use insulin, maybe 3.5 million multiple daily injectors, 1.5 million type 1s, and about 500,000 of those are on pumps. That's a tiny little red line there. If we zoom in on just the insulin users here, it looks like this. Now again, pumps are fantastic. They have great tools for the user. But if you're part of this blue group up here, InPen is the optimal solution. We launched the product just over 9 months ago with a WAC price of $665. We've seen a median copay of just $50 for an entire year. The product adjudicates favorably more than 70% of the time through the patient's pharmaceutical benefit. That level of coverage is unheard of for a new category device. And this month, we'll be rolling out true retail pharmacy distribution in the 62,000 non-pharmacies in this country. In our first 9 months in the field, with a sales force of only 6, we have about 2,000 users with another 1,000 referrals in the pipeline. That's more users and faster growth than other new category launches we've seen. I'm thinking about pumps and CGM here. In diabetes, we have more than one customer. We have the patient, the provider, the pharmacist, and the payer. And we have to hit them all. Right? So we've had a robust social media presence. We had a nice segment on the Today Show alongside Medtronic 670G and Abbott Libre. We, of course, had all the traditional trade shows. Had a nice write-up in Pharmacy Times as one of 5 pieces of diabetes tech you need to know about. Sponsored a Medscape CME class with over 12,000 learners. Of course, have our direct sales force. And one other thing I'll mention, if your healthcare provider mentions InPen to you, then that's easy. But if you want InPen, then you can go to our website, fill out the form. You can download the app and fill out the form, and we'll shepherd you through the process. As I mentioned, we've, until very recently, had a sales force of only 6. It is a national launch. Anybody in the country can buy InPen, but we've focused on several diabetes centers here. We're building champions. We're converting accounts to SmartPen technology. We believe that's ultimately going to benefit Companion as well as others in the industry by doing it this way. But there's been another benefit to doing this. It's helped us learn our patients and our customers that much better. And what we've heard is InPen is for everybody. Our customers come from everywhere. So durable pens, yeah, of course. Disposable insulin pens, that's our biggest customer base. And about 20% of our users come from pumps, which tells us that when you design a product that sits right in the middle, you're going to pull from both sides. The clinical utility of SmartPens generally, and InPen specifically, is obvious to me, but dose calculators, dose reminders, both have been well studied, but we do think we need our own trial. It's going to be starting this week at Hoag Hospital with Dr. David Ahn as the primary investigator. We're going to be looking at superiority versus MDI with time and range as a primary endpoint, both 3 and 6 months, with secondary endpoints of A1C, hypos, adherence, and quality of life metrics. So today, InPen is most appropriate for carb counters using bolus insulin here in the United States. We'll be quickly expanding that to all methods of calculating your insulin dose, all insulins, and around the world, certainly to include Europe as well as Asia. We've recently expanded our manufacturing facility to increase our current 1,000 pen per month manufacturing capacity to over 10 times that in 2019. And we can go even farther in the coming years through the addition of automation. When you design the most advanced integrated diabetes management product for multiple daily injectors, there's bound to be some IP involved. We've been diligent about filing this. We now have 7 distinct patent families that cover some significant inventions that are going to limit the commercial success of some other devices. One example of this is our 2 issued patents over here on the left, which are on prime differentiation. So I mentioned this earlier, prime, clearing your needle, injection, and therapy dose. Imagine going into your app and having to tell it for each and every injection whether that was a dose or a prime. With InPen, you do not have to do that. It's all completely automatic. In summary, we've seen strong adoption momentum in terms of number of users, number of prescribers, number of prescriptions, and the insurance coverage we've received. We serve 98% of a huge market with a high margin product and a recurring revenue stream. We believe our focus on user experience, intellectual property, know-how, and our time to market advantage constitute a significant competitive advantage, as does our team. And I think we have the best team in the industry. And if you want to design an integrated diabetes product, then you've got to get your team from glucose monitoring. You've got to get them from insulin pumps, from pharma, and we've done just that. And our team has been ridiculously efficient in terms of time as well as resources in getting our 2 FDA clearances, our CE mark on both iPhone as well as Android, and launching both those products. And today we've talked about diabetes, but I think we can see the obvious application of a technology like this to infertility, to Crohn's, to rheumatoid arthritis and other conditions. So we've been hearing that smart pens are coming for years, right? And for many of us here, that may have been all you've ever heard. So I hope you take away from my talk today that smart pens are here. That smart pens are the most broadly applicable in 4 categories of insulin delivery, that InPen is the strongest new category launch, and that Companion Medical has set the bar high, and we intend to continue to lead from the front. Thank you.